This video will explain information about deprescribing prokinetic agents. So you are probably wondering, what is deprescribing? Deprescribing means lowering the dose or stopping a medication that may no longer be helping or may be causing harm. So why deprescribe in hemodialysis patients? Hemodialysis patients may take up to 12 medications each day. Also, since many medications are not studied in hemodialysis patients, the benefits and harms of these drugs are unknown. Hemodialysis patients may also have a harder time getting rid of drugs from the body, so patients may end up experiencing more side effects. What are prokinetic agents? Prokinetic agents are used to treat symptoms of slowed stomach emptying, such as nausea and vomiting. Some common examples of prokinetic agents are domperidone and metoclopramide. The reason that we reduce or stop the dose of a prokinetic agent is that even though these drugs may relieve symptoms of nausea and vomiting with short-term use, long-term use in hemodialysis patients like you can cause side effects of drowsiness, unwanted movement of your lips, tongue, face, and other body areas, heart problems, and shaking of your hands. It may also cause a rare but life-threatening condition that causes fever, confusion, and muscle and movement problems. So, we want to reduce or stop the dose of a prokinetic agent safely. How do we do this? Patients who have been taking a prokinetic agent for more than 4 weeks may be considered for the deprescribing trial. Pharmacists, doctors, and nurse practitioners will help you decide the best way to reduce your prokinetic agent dose. This may include lowering the number of milligrams you take by half for a few weeks before completely stopping the medication altogether. So there are some things that your healthcare team will monitor for after stopping or reducing the dose of a prokinetic agent. These include nausea, vomiting, and recording the number of times you defecate. You may be wondering what to do if your nausea or vomiting continues. If this is the case, then there are different things that your healthcare team can recommend. This may include returning to a lower dose of the prokinetic agent that you were already taking. For example, if you were previously taking domperidone, you may return to a lower dose of domperidone. There are also non-drug related ways to manage nausea and vomiting. These include eating small meals more often. Also, another way is to limit the amount of fat and fiber that you eat. These are things like fruits and vegetables. Blending food before eating and limiting the amount of alcohol that you drink may also be helpful to control nausea and vomiting. Your healthcare team will go over with you your personalized prokinetic agent dose reduction plan. Overall, the goal of deprescribing is to lead to better patient outcomes. Please contact your doctor or pharmacist before stopping any medication.